Hey, hello, Linda Green in
I
Guatemala.
did.
Just a dog trainer and behaviorist extraordinaire for us. Thank you so much for helping with all our pets here that are having little difficulties and needing a little bit of help. So today, can we touch on happy touch, restraint, making it easy at the vet hospital and going through a lot of procedures. I really liked on a previous discussion that often we will resort to treats to keep an animal busy, to keep the dog busy. But you certainly highlighted there's a big difference between using a treat as a distraction and using a treat as reward. So can you expand on this a little bit more?
Yeah, so when we bring our dogs into the vet clinic, usually they're not super comfortable. Unless they're a very green puppy, they might have already had a couple of not so pleasant experiences at the vet clinic. So they're already a little bit guarded, and a lot of times the tech will have to pick them up and put them on a table or wrap their arm around them and restrain them, and that's pretty invasive and pretty uncomfortable for most dogs. So you can force the dog into compliance, but it usually makes the situation more stressful for the dog, for the owner, and it can put the staff at risk, and it's also hard work for the staff. So a lot of procedures can just be done with the dog by having some really yummy treats for them to distract them. So things like squeezed cheese, whipped cream in a can, peanut butter on a licky mat on the exam table or on the floor can distract the dog. The dog's quite happy eating the yummy food, and the veterinarian or the technician can actually do the shot or the blood draw or whatever they need to do without the animal almost even noticing. And so if the animal's busy doing something he likes while the vet or the technician is doing something that he wouldn't normally like and he doesn't even notice it, we're not really training the animal. We're just distracting him and keeping him happy and calm. And it's making a positive association. If he gets something really delicious when he goes into the room with this doctor with her stethoscope and her white coat, he might look at the doctor with her stethoscope the next time, kind of going, what am I going to get today? As opposed to, I don't like this scary person who hugged me and forced me to do something that I wasn't comfortable with.
So yeah, so the idea of using treats, and by the way, for us, we have two types of treats, some that are hypoallergenics and some with meat on them that dogs don't have allergies. Always ask which one they can use. But the idea behind is certainly we don't have time in a 30-minute consult, for example, to try to use treats as reward and imprinting new behaviors. Most
Yeah.
of the time when the treats are just used and we're not concerned about reinforcing good or bad behavior, because certainly by the time, for example, if we're looking at a dog's mouth and the dog is not happy about having his mouth handled, may start to growl a little bit. By the time we're growling, we've already escalated. So by the time that the dog takes the treat on the floor, but they go on the table, they're not taking the treat anymore. We're already in a bad place with that dog. And then if we start hearing a little bit of growling, we've really pushed that dog over the edge, right? So we need to back up. We need a new strategy at that point, correct?
Yeah, so you've got a couple of options there. You can force the dog, and it's not going to be pretty for anybody. Or you could maybe try to do the exam back on the floor where the dog was more comfortable. Or if the dog is now super stressed and going, hey, I don't really want you touching me, lady, now you might have to sedate the dog to finish the exam so that you're not stressing him and pushing him into higher and higher levels of fear and anxiety and potential aggression. So, yeah.
Right.
Good information if the dog was taking a treat and now isn't. That's real good information for the vet and for everybody handling the dog that you've actually exceeded the dog's comfort level.
Oh, wow. And by the time they're fidgeting and giving us physical cues, we're even at a higher level. So we have to, yeah, we have to back up. And for us, for example, any pet over 50 pounds stays on the floor. So we wear knee pads and we work on the floor. It's much easier for everybody. But certainly by the time they're giving us some cues, like you're saying, they're taking treats and now they're not. They're fidgeting, they're looking sideways. All of those signs are saying we're getting close to the edge for those dogs. So
Yeah.
yeah, we have to back off a little bit for them and give them a little bit more time and space also to appreciate the situation.
Yeah.
Certainly, certainly. Do you have any tips for owners, pet owners, to handle these situations as well, or get them ready for these visits? certainly for me as a veterinarian, I like that the pet owner is with their pets. 99% of the time, I find that working together, they're able to clue me in as to what will work and what will not work. We've got a great clientele, and I really trust what they're able to communicate with us. They know their pets very well. But any tips for pet owners on this about trying to solve these issues where pets are uncomfortable? And often it becomes their fear-based issues that they may have carried over from the time they're puppies, right? And only escalated.
Well, the owner can work on basic husbandry behaviors and stationing behaviors with the pet at home and get the pet used to, for example, having its forearm extended for a blood draw or something like that. And then the owner could actually hold the pet's forelimb while the technician takes the blood. If the owner does any trick training with their dogs, just having the dog go through a basic routine of tricks can calm the dog down because he's doing something, right, that he's familiar with. Taking in a bath mat or something that's not slippery for the dog to stand on, especially if it smells like home, he's done some training on it, can make the place a little bit more familiar. That's actually a nice way to calm down the dog. Keeping your voice happy and cheerful, making sure you're taking in really high value treats for your dog, whatever your dog really likes. The vet has some treats, but there's some fancy treats that you can use that the dog might not normally get, like squeezed cheese or whipped cream, peanut butter, those kind of things. If your dog really likes those, bring that in for them. Getting the dog to lick them off a licky mat, or you smear it on a paper plate or a plastic plate for the dog to lick. Licking is calming, putting their head down is calming. So all of those things can keep the dog distracted while the vet or the tech does the procedures that they need to do, and the dog might not even notice it, might not even feel the shot. So yeah, you can work pretty hand in hand with your vet on that.
And you know what? That's awesome because more and more I've seen certainly pet owners coming in with their favorite treats for their dogs, are high value treats that they get only for those situations. So I love that and appreciate that very much. And more I've seen, we use yoga mats a lot for dogs, so they're not on a slippery surface, especially when they're on the floor. When they're over 50 pounds, obviously we keep them on the floor. So we use yoga mats so they can't stand. But I've had some people bring their own mats that the pet would stand on at home as well. And my God, that makes a big difference. So yeah, those are good. There's anything else you want to add onto this topic? Oh, I just wanted to ask one more thing. The idea about restraint, and it's certainly kids, hugging dogs, and with the association that dogs, it's not a comfortable feeling for dogs to be restrained because it's actually very threatening for them, right?
Yeah. So we're primates, and primates hug. That's kind of what we do. Monkeys and apes and humans. Dogs don't hug. So most of our dogs learn to tolerate, and some even like our being hugged by their people. But almost no dog likes being hugged by not their people. And veterinarians and technicians are definitely not their people. So restraint is scary. A hug in a dog's world is restraint, and restraint is usually the precursor to being killed and eaten. So it's not a good thing. And most dogs are quite sensitive about having their paws handled, because if they have a serious paw injury as a wild canid, they're likely to die. They're likely to starve to death. So most dogs are quite sensitive about having their extremities handled, and they really don't like being hugged. So if you can train your dog to station and put his chin in your hand while the vet does a vaccine, for example, it's so much less stressful than having a technician hold the dog and pin the dog and, manhandle the dog.
Yeah, and certainly we've learned, certainly working with reserve dogs, certainly restraining a reserve dog has never been a good idea. They've never been handled that way. It's never a good result. So certainly what we've found very successful, and I use that a lot in our vet hospital, is a donut technique. So we'll take a really big towel and roll it up as a donut, and we just put that around the neck, and we can just hold the towel under the neck. So actually we're not restraining the body, we're just keeping the head looking forward while the owner is able to give treats. And that prevents them from looking back because the towel is quite big. So it's actually a very effective way for us to work, because yes, the restraint just, doesn't work.
It's much less invasive for the dog to feel something here than have something around its body.
That's right. And it forces them to look forward, so they're not really paying attention to what's happening back behind them. Well, thank you so much again, Linda.
Excellent technique.
That's awesome. Okay, well, we'll catch up on the next one. Take good care. Bye.
Have a great evening. Bye-bye.